Welcome to Wednesday's edition of COVID-19. I'm Min San-hee. Today, high school seniors headed back to school, but some were notified early this morning of further postponements following reports of infections. The opening of schools for other grades is poised to take place in phases after close monitoring of the adjustments of seniors at schools. In the meantime, we start our program with related headlines with our Kwon Soa and Noaram. Welcome.
Hi.
So like I said, it's the first day of school for high school seniors, but the nation remains on high alert because of an increase in domestic infections.
Right. High school seniors, as you said, were the first students to return to school in a phased resumption of regular education, but it's not back to normal as the country is still dealing with new infections. If we take a closer look, we have 32 new cases after being in the teens for the past 4 days, and that brings the total number to 11,110. The death toll remains unchanged at 263, and the country has reached a milestone with more than 10,000 recoveries, as almost 130 people were fully cured in the span of 24 hours. And by region, we have 10 new cases in the capital Seoul, also 10 in Gyeonggi-do province, and 8 in Incheon, meaning 28 in and around the capital, and 1 case each in Daegu and Jeollabuk-do province. Meanwhile, we have 8 imported cases, while the rest of the 24 cases are domestic infections.
So it's clear that domestic infections is on the rise here.
Exactly. While the Itaewon-related case could have grown into an even worse situation, the government is still warning of vigilance, especially at high-risk facilities, such as nightclubs and singing rooms. Officials said inadequate preparedness regarding entertainment facilities are seen to be the result of the latest cluster outbreak in the capital region, with the Itaewon case having resulted in a total of 193 infections as of Wednesday, with more than half occurring in Seoul. Whereas mass infections at places of worship and hospitals have not been seen since the government implemented strict guidelines on such facilities. Speaking of hospitals, so far, the outbreak at Seoul Samsung Medical Center appears to be relatively minor, as just 1 additional case was confirmed this Wednesday, bringing the total to 5. Seoul Mayor Park Won-soon said earlier that the route of the first nurse who tested positive 2 days ago is still in investigation. More than 1,200 people have undergone screenings, and over 120 are being self-isolated.
Right, moving overseas then, there's been a surge in fatalities in Brazil, and countries in Europe are cautiously easing restrictions, I hear.
Yes, so let's begin with Brazil, which saw a record single-day high in deaths as well as infections on Tuesday. And the South American country, with a population of 210 million, has emerged as the world's fastest-growing COVID-19 hotspot. Brazil confirmed 1,179 fatalities from Monday to Tuesday, raising the total to almost 18,000. More than 17,400 infections were added in a day, bringing the total number of COVID-19 cases to over 271,600. Sao Paulo alone had 324 deaths, surpassing 5,100 mortalities in total, and around 66,000 total infections. Authorities say the country is losing the battle against the virus. Meanwhile, declining numbers are being observed in Europe, though Italy, which reopened restaurants, bars, retail stores, hair salons, and museums this week on Monday, has seen its daily coronavirus fatalities rise to 162 on Tuesday after a 4-day fall. And now here over in Spain, Spain has also seen a slight rise in deaths, according to Tuesday's figures for Monday at 83. But for 3 consecutive days, the death toll has been below 100, which is the lowest in more than 2 months. The Spanish government is set to extend the country's state of emergency order by 2 weeks to mid-June, while it had been mulling over a longer extension until the end of next month. And now turning to our global map, total infections are slowly approaching 5 million, now standing at more than 4.9 million. Meanwhile, 1.9 million have recovered, while the death toll stands at 324,890. Let's take a look at some major outbreaks here. The U.S., far over 1.5 million cases with more than 93,000 fatalities. And Russia has almost 300,000 total infections, followed by Spain and Brazil. Pretty similar figures when it comes to the total number of infections there. Meanwhile, Germany, Turkey, and Iran all have far over 100,000 cases. And those are the global updates.
All right, so thank you for that. I'll come back to you after the regular briefing.
All right.
Arirang, high school seniors are back in school after nearly 3 months away from school grounds.
That's right. Now, this will be certainly a test of the government's ability to control the outbreak within schools. It has done so well so far, but there is still a sense of anxiety in the air as a recent spike in cases, as we know, has left parents and students on edge. Now, to alleviate these anxieties, strict hygiene measures are in place. Thermal cameras will be installed at school gates and temperatures will be checked not once but twice a day. Students will also sit far apart from each other and masks must be worn at all times, except during meals, of course. And cafeterias will have transparent partitions between the seats and students will also sit a fair distance apart from each other. Class sizes will be reduced, so classes with more than 30 students could be divided. High school seniors have to go to school every day, and for those in other grades, every other day or every other week. And students in lower grades will go back to school in the coming weeks and will have a mix of online and in-person classes. Now, there have, as you alluded to in the opening, there have been high schools in Incheon that have sent students back home after 2 high school students tested positive there. All high schools in Ansong, meanwhile, have also decided to remain closed after a case was confirmed there as well. There have been smaller schools, however, with fewer than 60 students that have reopened regardless of grade. So that includes some elementary schools in rural areas as well.
Oh, I see. Arirang, Korea has secured a prominent position at the Global Health Organization, I hear.
That's right. Korea has joined the executive board of the WHO. It is actually, in fact, the 7th time that it has done so. So it's not the first time. It has been on the board before. Now, this will allow the country to play a leading role in resolving global health challenges, and the confirmation of Korea's appointment came after Tuesday's World Health Assembly, which you covered very well yesterday. Now, Korea is one of 10 countries to become a new board member and will serve until the year 2023. The nation's first meeting as a member will take place on Friday during a WHO video conference. And board members can screen the WHO's budget and play an important part in drawing and implementing policy. So quite an important role there. And as an executive board member, Seoul's health ministry said Korea will actively share with the rest of the world its experience in dealing with the COVID-19 outbreak, which has been widely praised, and also play a role in the post-coronavirus period, which is also critical as well.
Right. Now, many countries hope to mirror Korea's measures against COVID-19, and I hear the UK is one of them. Arirang.
That's right. The UK government says it will try to emulate South Korea's contact tracing that has been a success. And this was Dame Angela McLean speaking at a press briefing in London. Have a listen.
The two I would draw particular lessons from would be South Korea, where I feel they've made inspiring use of all kinds of different contact tracing in order to control infection. And I think that is an experience that we are aiming to emulate.
Right, the other country the advisor was alluding to was Germany, in fact, which has also been praised for its response to the pandemic. Now, following her comments, UK ministers are now preparing to ramp up the search for those with symptoms by using an app which is run by the UK's National Health Service, as well as a team of contact tracers. So they need to expand their network on that, and London is also looking to improve on its testing capacity like it has been done in Germany and South Korea as well.
Okay, Arirang, thank you for that. We'll see you again tomorrow. It's a little after 2 p.m. here in Korea, and we are poised to join the regular afternoon briefing on COVID-19 in this part of the world. Concerns are mounting over yet another cluster infection here in the capital city, this time at Samsung Medical Center, where at least 4 nurses have tested positive for the virus. We just heard from Swa that 1 more has been confirmed to have the virus too. The transmission routes remain unclear, raising fears that the number of cases may surge in the next couple of days. investigations are underway to determine the source of these latest infections, and more than 600 people who have come into contact with these nurses are being tested as well. Meanwhile, cases linked to clubs in Itaewon are also on the rise. The total number of infections stands at 193 as of early Wednesday, regarding the cases at Itaewon, of course. With high school seniors having started school today, health authorities are calling for continued caution and compliance with daily life quarantine guidelines, including the wearing of face masks, the washing of hands, of course, avoiding of crowded and confined spaces, and practicing of good personal hygiene, including the decision to self-isolate in case of suspicious symptoms. Here on the chart, we have the list of daily life quarantine guidelines that the government has been recommending, that is. They're asking you to stay at home for at least 3 or 4 days if you feel sick, and to stay 2 arms length away from others. Wash your hands for 30 seconds and cough into your sleeves, and make sure you ventilate at least twice a day. Remember also that health authorities are calling on you to leave your windows open if you're using the air conditioner this summer. Here now is a briefing. We'll come back to you afterwards.
먼저 정은경 본부장 설명 있겠습니다.
Let us now begin our regular briefing for the COVID-19 response. As of May 20th today, we have 32 newly confirmed cases, and the total number of confirmed cases now stands at 11,110. And a total of 128 more people have been fully recovered yesterday, and they account for about 90.6% of the total, and about 10,066 have been discharged so far, and 781 are still in quarantine. We had no additional fatality. Yesterday, out of the 32 new cases, 8 were imported cases, while 24 were locally transmitted cases. And looking at the imported cases, the countries of origin, 2 were from Americas, 6 were from others, and they included 2 from Saudi Arabia, and also 4 people who are Pakistan citizens. And also next is about the locally transmitted cases. We have confirmed that 4 nurses have been confirmed positive at the Samsung Medical Center, and we carried out an emergency quarantine and disinfection, and this includes 25 surgery rooms on the 3rd floor of the building, and also we closed down these rooms as well as the rooms for the nurses and other staff members. And we also carried out testing for all of the people who are working there as well as the patients, and we carried out an isolation of about 25 people. And we carried out the testings for nearly 1,200 people, and of them we confirmed that 3 of the nurses who have been already confirmed have been also tested positive, and we have learned that 640 people have been tested negative, and as of now we do not have additional cases for this hospital, and we will continue to closely monitor these people, and we will also conduct our screening testings for the 8 patients who have been discharged from this hospital very recently. And as for the infection relating to the clubs, as of today we have a total of 196 people, and 100 from Seoul, and 41 from Gyeonggi-do province, and 35 in Incheon city. And 95 of them were visitors to the club, and the contacts, including the families and acquaintances, accounted to 101, seeing a higher number than the number of visitors. And the Incheon metropolitan area, they are currently seeing transmission of the club infection to coin singing rooms and taxis, as well as other facilities. Therefore, starting from May 6th to May 19th, they are looking into whether people have visited the Vision Plaza building in Michuhol-gu district, and they also ask the people who have visited the facilities located in this building to get tested at a screening clinic. And we also identified that some of the facilities in Gyeonggi-do province were visited by those confirmed people who have been from the visitors to the Itaewon Club. And we included these the names of these facilities in the press kit. So we asked all of the public if they have been to these facilities to get tested as well. And we continue to stress that anyone who visited any of the nightlife entertainment venues in Itaewon area, including any clubs or bars from 24th of April to 6th of May, to get tested as soon as possible, regardless of symptoms. And in particularly, if you work in education, places of worship, indoor sports facilities, or other places that are frequented by people, we ask you to be tested as soon as possible, since your work environment creates a high risk of transmission. And even if you have tested negative, it is still possible for you to have been infected, but in the 14-day incubation period before the virus activates. Therefore, those who have been instructed to self-quarantine should strictly follow the protocol. And if you are not subject to self-quarantine, you should also minimize contact with others and get tested if you have additional symptoms. And the quarantine authorities are closely cooperating with the education ministry, and we are also monitoring the health conditions of the faculty members, teachers, and students. We are highlighting that the people at schools need to wear their face masks and to comply with the basic quarantine protocols. And as we resume going to the school, we also advise all of the students to refrain from going to PC rooms and singing rooms. And we also ask the faculty members to refrain from going to multi-use facilities, including bars, clubs, and others. And also at schools, we advise them to carry out the body screening, the temperature. And we also advise you to wear your face mask at all times, and if anyone shows suspicious symptoms, you need to directly and immediately contact the parents and the guardians of the students. And if a confirmed case is found within a school, all schools, teachers, students, and staff of the school will be instructed to be disinfected and quarantined. And as we see an increase in the rise of local transmissions related to clubs, bars, karaoke rooms, and after-school private academies, we urge people to refrain from social gathering or visiting any enclosed spaces that are frequented by people. And if you have made a contact with a large number of specific people in an enclosed and confined space, you need to also get tested, and please visit our screening clinic to do so as soon as possible. And we also urge people to visit a screening clinic and get tested, especially if 2 or more people within a household or social group develop COVID-19 symptoms. Today, in 3 months, it is the first day for our high school seniors to go back to school physically, and the cluster infections, especially in the metropolitan area, is increasing starting from Itaewon Club, and it's leading to PC rooms, private academies, as well as other facilities, and many people have been infected, including the senior students of high school. And we understand that there are much concerns from parents and teachers, and once we can free the COVID-19 risks from the schools, we believe that we can effectively control this within our society. And we believe that the COVID-19 is difficult for us to combat, and this will also research here at home and abroad. And the most effective measure is to curb the further spread by keeping strictly to the social distancing measures, as well as personal hygiene measures, including washing of your hands and wearing your face masks. And we believe that our households, the community, and our schools, the safety of these places needs to be prioritized. And in order to secure this safety, we need to make it a habit to wear our face masks. Thank you very much.
Right, that was Chang Eun-kyung, the head of KCDC, with the regular afternoon briefing. Swa, to give us a summary of the key announcements.
Well, first off, let's start with some relieving news regarding the Samsung Medical Center. No additional infections have been reported as of this afternoon, and the majority of some 1,200 people that had potential to have had exposure to the virus have been tested, and so far all the cases seem to turn out negative. The day before and yesterday and the day before, we had 4 nurses confirmed that were at that hospital, and an additional case was added earlier in the day, which was a friend of a nurse, but that was outside of the capital. Meanwhile, as Ara mentioned earlier, some 66 schools sent back their students in Incheon because, as KCDC Chief Jung Eun-kyung just mentioned, 2 senior high school students tested positive, and they visited facilities such as singing rooms. And we know that singing rooms and also PC rooms are some facilities where with high risks of infection. Chong mentioned for the first time in 3 months, these students are returning to school while cluster infections in the capital region are increasing. So she asked for caution at singing rooms and PC rooms. In fact, she said to refrain to visit such facilities and also be careful at after-school academies.
All right, Swa, thank you for that. We'll see you again tomorrow.
Thank you.
Now, in his most recent weekly session with pundits as part of preparations for a post-pandemic world, Prime Minister Chung Se-kyun sought to explore ways to ensure hygiene and health in a strategic manner to limit the consequences of future contagions. Let's take a look.
The South Korean government is now holding the so-called Thursday Conference, which is a gathering of government officials and scholars to prepare the country for a post-pandemic future. It is presided over by Prime Minister Chung Se-kyun, and the participants have discussed a number of ways to turn the current crisis into an opportunity through its meetings so far. During the third gathering of the Thursday Conference, those in attendance shared ideas on ways to seamlessly integrate the government's quarantine and everyday life guidelines to the daily routines of Korean citizens.
언택트 문화, 비대면 접촉 등 코로나19 이후 새롭고 광범위하게 목도되고 있는 사회 현상은 우리로 하여금 사고의 혁신 그리고 과감한 도전을 요구하고 있습니다. 나아가 일상화된 방역의 시대에서는 감염 예방을 위한 비대면 진료 확대, 원격 모니터링 서비스 발굴 등 보건 의료 대책의 과감한 중심 이동이 필요합니다. 특히 국내 의료, 바이오 산업 분야에도 첨단 ICT 기술과 4차 산업혁명 기술을 적용해서 스마트 비대면 산업을 세계 최고 수준으로 육성해야 하겠습니다.
A South Korean medical expert has proposed a number of methods to aid in this transition based on analysis of COVID-19 and its key characteristics.
우리가 감염 재생산수를 R이라고 하는데 R은 이 PCD 3가지로 결정이 됩니다. 코로나19에서 우리가 피를 줄이기 위해서 마스크, 고글, 장갑, 기침 예절, 사람 간의 물리적 거리 두기를 합니다. D를 줄이는 것이 환자들의 감염 전파 기간을 줄이는 건데 이게 의료인이나 방역 당국이 하는 일입니다.
A recent cluster infection at a popular nightlife district in Seoul has reminded the nation that the battle against COVID-19 is far from over. In response, QR code surveillance in crowded areas and flu vaccinations for the more vulnerable segments of the population have been proposed as possible countermeasures.
이태원 사건이 나면서 굉장히 빠르게 검사를 확대해야 되는데 검사를 확대하는 시스템이 좀 유연하지가 않습니다. 지금 현재 의사가 검사하고 간호사나 임상병리사가 검사할 때는 의사의 지도 하에 하도록 되어 있는데 검사 인력을 확대해야 되고 실제 독일 같은 경우는 아이들이 자가 검사도 합니다. 자가 검사까지도 확대할 준비가 필요할 것 같고요.
The Korean government has reminded the public that life may never be the same again in the post-pandemic world, despite the easing of social distancing rules. The country must now implement policies to reflect these permanent changes, such as supportive measures for sick leave and work-from-home occupations.
학교를 닫고 열고 할 때는 그것의 케어의 임플리케이션을 고민해야 돼요. 그렇지 않고 우리가 그냥 위험하니까 닫겠다. 긴급 보육은 좀 남겨주긴 했지만 나머지 그럼 어떻게 그 케어할 여력이 없는 사람은 어떻게 그걸 감당하라는 이야기입니까? 그러니까 그런 고민을 같이 해나가면서 해야 된다는.
The pandemic has also rekindled debate on the adoption of telemedicine, which has been a controversial topic among policymakers in recent years.
비대면 진료도 사실 지금처럼 이 감염 위험 때문에도 단순히 이제 소비자 편의만이 아니라 환자가 오는 과정에서 의료기관이나 의사 선생님이 감염될 수 있으니까 이제 비대면하는 것 이런 제도적인 뒷받침이 필요 있어야지만이 사회적 거리두기나 방역이 잘 되는 것이지 그렇지 않으면 누군가는 히든 소셜 코스트를 눈에 보이지 않는 사회적 비용을 안을 수밖에 없다는 거죠.
South Korea's Thursday conferences have become an important platform for the free exchange of ideas and cooperation among people from various walks of life, as the country continues to take an open and proactive approach in dealing with the pandemic.
C'est la première pandémie à l'époque de Internet et de la couverture médiatique instantanée. Donc ça nous donne ce sentiment justement que nous sommes tous embarqués dans un même combat, une même difficulté. Bon. La stratégie qui a été menée contre le Covid-19 en Corée du Sud est la meilleure. Tout le monde est en train d'imiter avec un peu de retard ce que vous avez fait, les tests, la recherche des foyers de maladie, l'isolement des malades, mais apparaît comme une leçon de stratégie politique, stratégie économique et stratégie sanitaire. Il ne faut pas relancer l'économie, il faut relancer le travail, ce n'est pas la même chose. C'est-à-dire que, il est normal que les États aident les travailleurs qui ont perdu un emploi, les petites entreprises qui sont en faillite. Il faut leur faire des prêts à long terme très généreux. Il faut simplement aider les travailleurs et les entrepreneurs à retrouver le chemin du travail.
이미 우리는 선진국이라고 말하기 시작했습니다. 우리가 따르고 싶었던 나라들이 우리를 배우기 시작했습니다. 우리가 표준이 되고 우리가 세계가 되었습니다.
Il est clair que la manière assez remarquable dont a été gérée cette crise sanitaire, qui encore une fois n'est pas terminée, a placé la Corée sur la carte du monde, et pas seulement pour la musique, le cinéma, mais l'a placé comme une société assez exemplaire dans un domaine où on l'ignorait. Donc on va regarder la Corée du Sud autrement. Ça aura évidemment un impact positif sur ce que vous appelez la compétitivité, mais surtout le premier impact, c'est le regard sur la Corée du Sud va être complètement modifié. On va la voir comme une civilisation en tant que telle.
Indeed, Korea has been garnering quite a bit of international attention for its COVID-19 containment efforts, with the more recent interest coming in from the UK, as we mentioned at the start of the program, where a key advisor to the government highlighted Korea's inspiring use of diverse contact tracing to curb the spread of the virus. Now, this is just one of many areas of interest, that is, which range from the treating and testing and to others. To discuss this in detail, I have Professor Im Eun-jung from Gongju National University. Welcome to the program,
Thank
Professor.
you.
And I also have Frank Smith, a journalist for Deutsche Welle. Hello, Frank.
Good to be back, thanks.
Professor Im, as seen in the video earlier, Korea has received much global praise for its expeditious and extensive testing ability. To what extent has this reality positively affected Korea's image, perhaps, on the international stage?
Yes, certainly this COVID-19 pandemic, I'm sorry to say this to the victim, who sacrificed their lives, because of the disease, but thanks to the Corona-19 pandemic, Korea's position certainly upgraded, in the world political arena. It is a so-called G0 situation these days, according to the Dr. Ian Brima, who argues that, again, the U.S.'s leadership has declined, whereas China is not that ready yet, for the global leadership. So many countries probably are looking for a new leader or new model. It doesn't need to be U.S. or it doesn't need to be probably China, like very overwhelmingly, how would you say, large, powerful country. But Korea-like country, middle power, with a smart power, I think, can be another good model. For many countries. Again, thanks to this opportunity, I think we certainly show that.
Frank, do you think that Korea set a benchmark given its tackling of COVID-19? We have seen a surge in cases because of the Itaewon outbreak, but prior to that, we had been seeing figures in the single digits for local infections.
Actually, I think the recent outbreak will serve to reinforce South Korea's position as being able to contain the COVID-19 outbreak so successfully. Specifically, its contact tracing, its ability to pinpoint who infected who, track down the people that have contacted those individuals that already have the virus, and the sacrifice of private information in order to successfully conduct that contact tracing, I think, is key. And that's really the reason South Korea is providing such a benchmark to the international community here.
I think the president called that the taking of individual freedom to turn it into a greater freedom for all. Professor Im, do you expect a significant shift in the balance of power, perhaps the socio-economic landscape in the aftermath of COVID-19?
Yeah, there are many different expectations or predictions about the post-corona pandemic world. Some will say it's going to be still the globalization will not stop, or others will say it will be already, it's already over, right? There are lots of optimistic, pessimistic view, but I would like to cite Dr. Richard Hess, who is the president of CFR, Council of Foreign Services. And recently he published his article in the Foreign Affairs, and the argument is, again, this pandemic will accelerate actually the history rather than reshape it, which means, again, the geopolitics anyhow, it's again back to the table or back to the political arena. What I'm trying to say is, again, the G2 rivalry, again, the US-China rivalry will be getting more, I guess, again, the increasingly serious, and not only just in the conventional security areas, but also in the non-conventional security areas too.
I see. Frank, many developed nations, including the US and others in Europe, have been experiencing difficulty in containing COVID-19. How aware are these countries of their shortcomings, do you think?
Well, I'm not sure if they've learned their lesson. One of the challenges that was faced in the US and in Britain was the politicization of governance in both of those countries, where the leaders downplayed the pandemic at the beginning, sort of for political reasons, especially in the United States, and that didn't serve their publics well. Additionally, what we talked about earlier in terms of contact tracing, that sacrifice of individual liberty for collective good, I don't know that that message is getting across. When you look at some other things, especially in the United States, the absence of universal health care and the absence really of a social safety net, I think that's a lesson that the international community, again, and those specific countries, especially the United States, could learn from this. In the UK, of course, you had the NHS, the National Health Service, that has really been praised, especially by British citizens, step forward. But in the US, really, I think the absence of universal health care, and again, the absence of a social safety net, didn't serve their public well.
I see. Let's take a few minutes now to listen to the words of a futurologist in Hawaii who has predicted what a post-pandemic world might look like as we continue this course into uncharted territory amid the contagion.
Well, I think everyone would agree the most obvious change has been from physically commuting to telecommuting. There's been much more of that than ever before. Of course, we've had this potential for a very long time, but the virus has required us to do it. And my experience and observation is it's worked for the most part. I think the main change is that people are discovering that life goes on even though you're not working. And this fits into one of the main concerns that I've had as a futurist for a very long time. And that is we have already cut the relationship between work and access to goods and services. And yet we still expect people to work. Well, we simply don't need so many people working to keep the economy growing. And so I have always wanted to move not to full employment, but to full unemployment. And I think we might be moving in that direction now. If you ask what was it that made Korea successful and other countries like it, Singapore, for example, or the Nordic countries, even Sweden, which opened up, and Germany, what was successful in all of those places is trust between the government and the people. I know there's lots of complaining by Koreans about their government, but when things come down, Koreans have a very good civil service. The public administrators are honest and capable, and there is a bond of trust between government and people. And I think that's the most important thing that they have. Korea has done a good job of taking things that someone else developed and making them much better. Been a magnificent job of that. But a couple of years ago, several of your presidents have talked about Korea as a creative society. And they didn't really mean it. They didn't mean it in the sense of creating something new. They meant in the sense of just creatively adapting what others have done. But Korea needs to become a creative society in the sense of becoming a world leader. Not the world leader, but a world leader. And I think that Korea has this possibility better than almost any country in the world. At the present time, Korea is, as we say in Hawaii, no ka-oi. Everyone loves it. They think it's fantastic. The Korean wave that I've studied for the past 10 or 15 years is still rolling along, still doing beautifully, still attracting more people worldwide. So I encourage Korea and all Koreans to try to do something they've never been before as a country, and that is a world leader, looking for a new political economy that responds to the issues I've mentioned and many more, and creates a more just, a more equitable, a happier society for themselves and as a model for everyone else.
Right. Professor, lockdowns and travel restrictions have disrupted the flow of goods and the movement of people across countries, of course.
Yes.
Do you believe these disruptions have exposed perhaps severe vulnerabilities in the global structure and perhaps could serve as a catalyst for change?
Certainly, through this opportunity, we realized that how vulnerable, again, all this interconnectedness or global supply chain, which has been developed throughout the era of so-called globalization, neoliberal version of globalization. But at the same time, it revealed that how interdependent we are. So without probably trading our products or even my clothes or anything, right? We cannot actually maintain our modern life without, again, the trading with somebody else. So trading itself will not disappear. Absolutely, it is not the truth. I don't think so. But as long as U.S.-China rivalry gets more severe, some division might emerge. It will not exactly the same one as we experienced during the Cold War, but some kind of division between the U.S.-centered team and then China-centered team that kind of division might happen, I think.
I see. And under that kind of climate, Frank, what can Korea do to better accommodate for future plans, if there is such a division as Professor talks about?
Well, I think it's working on it. I thought those comments from Jim Dater were extraordinarily interesting. I think South Korea has already sort of investigating the policies that it needs to adopt for that post-pandemic world. One of them is reshoring, bringing some businesses and manufacturing and things back to South Korea. And the other one is regarding employment and a massive new deal that the government is considering. And also, you know, taking a new look at employment and our sort of mass consumption society also, I think, might be in store. We can expect to maybe spend a bit more, you know, for different goods as countries, again, reshore and bring manufacturing back home.
Professor Im, Korea has secured global praise, as we have seen in the video, for its response to the pandemic. Do you believe this reality offers Korea a chance to perhaps better cultivate its standing in the global stage?
Sure, I think it's already happening. As I mentioned earlier, again, South Korea is not that, you know, overwhelming to, you know, its neighbor or to other developing emerging market country. You know, it's a good-sized country. Again, the middle power, together with the smart power. Again, democratic governance. We showed that we didn't give up the free market. At the same time, we didn't give up the democracy. But at the same time, we showed the very, how would you say, unity, solidarity, or communitarianism. So we might, I think, hopefully, we can show a third way of a good governance to other countries. I think.
Frank, do you agree that our image, Korea's image, has improved in the international arena given its response to COVID-19?
Oh, absolutely. If you look at the, you know, the consequences of this pandemic internationally, South Korea was affected the least. I would argue really, though, that every country failed, even including South Korea, but it failed the least. This is perhaps the safest place to be, particularly considering the size of the country. And when you look at, again, the sacrifice that Koreans were willing to make in terms of their privacy for the collective good, that other countries around the world are looking at this and saying, okay, if we're going to protect ourselves in the future from this type of thing, we need to change our perspective. And that change in perspective could be applied to other areas of society as well.
Do you see such efforts perhaps being implemented overseas? For example, this decision to give up, let's say, your individual freedom for the greater public good?
I think that's going to be really tough, especially in the United States, where they have a natural suspicion of governance and a natural, you know, desire to cling to those liberties that they had fought so hard for, and that's such a strong part of the American identity. Giving those up is going to be really quite challenging.
Professor Im, what other actions or further actions can be taken by Korea to perhaps turn this particular crisis into an opportunity for the country?
Well, of course, it's a good opportunity to perform our good governance, but at the same time, I want to be more like objective. So I would like to actually suggest that for my governments, again, we really need to now focus on the economic revival or rehabilitation together with the fiscal sustainability. Now more and more countries just, you know, go to the quantity easing. It can cause, of course, inflation. It can cause so-called beggar thy neighbor effects. So we really need to be cautious about those kind of, you know, fiscal difficulty it can come in the near future. So hopefully, again, now government probably should focus on that specific one.
I see. Frank, what are your thoughts? What further actions does Korea need to take in order to ensure some form of safety, security in the midst of this pandemic?
Well, I think it's doing a good job. Just to speak to Professor Im's point, I think we need to be prepared also for some increased taxation. There have been these rescue packages that have been doled out by governments around the world, those are going to have to be paid for at some point. So you are going to perhaps see some inflation. You're going to see some expenses at the turnstiles, and publics need to be prepared for those for the ongoing economic health.
All right, Frank. Are there any other words?
No, I completely agree with him.
Right. Well, we'll have to see what the future holds for us soon. And Frank, thank you for your thoughts. And Professor Im, once again, thank you for being with us again.
Thank you so much.
Well, that is all the time we have for today. Be sure to join us tomorrow at the same hour. In the meantime, be sure to send your thoughts and inquiries to us through our social media accounts or our homepage, arirang.com. Thank you for watching and take care.